Hi, my name is Malik Abazda. Welcome to PM Express. He was a young, strong, well-built, professional policeman. He woke up one morning, came to work, healthy, excited, sharing jokes with friends. Closed from work, took his car, and then in the middle of the road on his way home, the car stopped. The car stopped near a fuel pump station. Workers of the station saw the car stop. They didn't bother to find out what had happened. Very many vehicles came and veered off this car. The next morning, they went to check what was happening in the car. Strong policeman had died in his car. How did a strong man die under those circumstances? Tonight, we discuss hypertension, and I have a consultant interventional cardiologist who has all the answers and guidance in this area. When we come back from the break, I will introduce him and we'll settle for this discussion. Stay tuned. You're welcome back. We are discussing hypertension. My guest is a consultant interventional cardiologist, Dr. Joseph Akama. Joseph Atia Akama. Doc, you're welcome to PM Express.
Thank you. Thank you.
Doc, when we say hypertension, what do we mean?
Okay. Good evening to your viewers, and thank you for having me tonight. It so happens that in 20 days, we'll be having the World Heart Day. So this is appropriate that we discuss hypertension.
Okay.
So hypertension is a condition where the pressure within the vessels, the arteries, are beyond the physiological limit. What it means is that everybody needs a pressure inside the blood vessels to allow the blood to flow. So it's like the water pump or like the waterworks that pump water. Now, if the pressure is low, it won't go to certain places. If the pressure is too high, the pipes might burst open. So similarly, the body needs a certain amount of pressure. And generally, the physiological pressure is individualized. Everybody has a different pressure limit. But generally, it's accepted worldwide that if your blood pressure goes beyond 140 systolic or 90 diastolic, then you are considered to be hypertensive. What does it mean? So, for instance, you're a young man, your blood pressure is usually 120, 130, thereabout. And then as we get older, the blood pressure can go up. Or for some reasons, stress, the diet we eat, smoking, all kinds of other things that causes blood pressure to go up, might make the blood pressure creep up from the 120 that you're used to say 140. Then the doctor will say you're hypertensive. And if it's persistent, then clinically you're hypertensive.
You used a lot of very technical terms, and
yes.
I appreciated the use of the pump, but you use terms such as arteries and vessels and all of that. Please break it down for me. For the illiterate woman in the village,
Yes.
how do we explain to her what is happening to her? If you were in the consulting room and an illiterate woman came to you and you diagnosed her to be hypertensive, how will you break it down to the person to understand exactly what is happening to her?
So I think using the pump and then the water in a hose is an easy way to explain to an illiterate woman, because most people will understand how water flows in a pipeline. So if we use a pipeline, for instance, or a water hose that you use to water your garden. So if the pressure within the hose, the water hose, is low, the water trickles out. It doesn't flow with a speed, with a force. Whereas if the water is adequately flowing, then you are able to water your garden or fetch the water without wasting too much time. On the other hand, if the water is coming at a very forceful pressure, then it can cause problems. So for instance, you point the hose to the ground with a very high pressure within the hose, it's going to dig the soil
Yes.
and cause a lot of problems. So similarly, if we relate that to your body, the body is supplied, all parts of the body, the organs, are supplied by blood vessels, which are like water hose. So the heart is a pumping organ. And what it does is every minute, your heart pumps blood to circulate around the body at about 60 to 100 beats per minute. And what it's doing is making sure that your muscles, your liver, your brain gets adequate oxygen and nutrients. So now the pressure within those vessels or the pipelines is what we're talking about. So if that pressure goes beyond 140, then you're hypertensive. Or the lower bottom goes beyond 90, you're hypertensive. Usually when the doctor checks your blood pressure, there are always two numbers, a top number and a bottom number. And the top number is called systolic pressure. The bottom number is called diastolic pressure. And these are the numbers that we're looking at.
Are there any circumstances that predisposes a person to suffering hypertension?
Sure. Hypertension, unfortunately, has been with man for a long time. For most people, 95% of individuals, including Ghanaians, we don't know, we can't pinpoint the cause. That's unfortunate. For about 5% of people, we can detect the cause, and when we correct that cause, the person becomes cured from hypertension. So the 95% of us, what could be the cause? Multiples of causes. One is it runs in your family. Two, a lot of stress. Three, the bad diet habits, the salt in our diet, the fast foods that we're eating. And then also alcohol. Young men and women who indulge in a lot of alcohol invariably will have high blood pressures. So beer, all kinds of alcoholic beverages will lead to high blood pressure. There are also episodes where people put undue pressure on themselves, multiples of activities within a short period, or even long term, can lead to stress, lack of sleep. Obesity is one of the causes of hypertension that we have to mention, in that a lot of people become obese, they don't sleep right, they snore, and by so doing, they lead to a lot of chemicals being released into the blood. One example is adrenaline. Adrenaline, when it's in your blood, increases your blood pressure. So when people are snoring in the night, it is not a good thing.
Okay, so there are so many of them: smoking, alcoholism, hereditary factors, stress, lifestyle, the food, the kind of food we eat. There are so many. Why is it that in spite of the advancements in medicine, we can only tell about 5% what the exact causes are? Is it a very complicated condition?
Yes and no. It is a complicated condition in that, by and large, you cannot pinpoint a particular reason. And sometimes it could be one reason. For instance, if the person drinks a lot of alcohol and you advise him to stop drinking alcohol, and the blood pressure will come down substantially, sometimes to the level where you may not need to put the person on blood pressure medications. Sometimes the alcoholism is not because he just wants to drink alcohol. It's because he's stressed. It's because he's depressed. It's because he's under a lot of undue pressure. So taking away the alcohol does not solve the other problems, the stress. If his eating habits are poor, like most of us are in Ghana,
what do we define as poor eating habits?
So poor eating habits is a very broad term, but basically the time we eat, the type of food we eat, the content of the food we eat, the taste, what we like to eat. So a typical Ghanaian dish, light soup with fufu. A light soup, if you buy it outside, tastes really delicious, but a lot of salt in it. Another one is the noodles, the quick noodles, fast food noodles.
Yes, Indomie. And there are Indomie joints all over the place.
All over the place. I do not want to mention names because I'm not particularly interested in talking about one particular type. But the fast food, there's a lot of salt in there because you want something quick, something that tastes. And salt for man has been one of our weaknesses. If you eat food that is not salty, you don't like it. So salt becomes the norm. So even if the food is not good, putting salt in it will make it tasty. Unfortunately, a lot of blacks, especially Ghanaians, will like a lot of salt.
Research shows, and I was just reading a few things before we came on air, about 1.56 billion people in the world's total population is projected to be hypertensive by 2025. That's less than 10 years from now.
Yes, that is catastrophic. And that is why we are talking about this today. It is real. In July, I was here to talk about hypertension. That was a World Hypertension Day. On 29th of this month will be World Heart Day. And the reason why the world community has to wake up is that currently in Ghana, from Ghana Health Service data, as of their report from 2014, hypertension and heart diseases rank #1 for outpatient visits. More than 70% of outpatient visits to Ghana Health Service facilities.
More than even malaria.
It's more than malaria. And when you look at the death toll from hypertension, heart diseases, stroke, it's unbelievable. The unfortunate part of this in Africa is that it's targeting young, energetic, productive age group. And that is the sad aspect. So we have to wake up. It's a wake-up call.
Is it because this age category tend to have lifestyles that exposes them to hypertension? For example, you mentioned smoking, alcoholism, reliance on fast foods. Is it because this age bracket, because largely between 18, 20, and 35, that's when people are out of home, they are working, and so they will buy fast food, and at the weekend they will go and meet boys, and they will take a few bottles here and there. Do these things contribute significantly, would you say?
Malik, you've just hit the bull's eye. That is exactly what is happening now. We have really grown into a culture which is faster than what we should have grown into. Africa is going through a transition, epidemiological transition, which is unparalleled. In the West, they went through these transitions step by step. So they adjusted their health system to mitigate some of these changes. Unfortunately, Africa is transitioning so rapidly from nothing to high technology, from nothing to stressful environments, to episodes where the society that used to buffer us does no more exist. So if you look at parents and grandparents, they used to have society. We have lost that society because of rural-urban migration. You come to Accra, you don't have your village champions with you to socialize. You don't have anybody to bounce your sorrows on. So you're left alone. So you take to stress. And then weekends, you want to have some happy times. You indulge in alcohol. Alcohol goes with kebab. Kebab is spiced with good peppers and salt, unfortunately. So these are the basic things. And if you look at what the world community is telling us, if you can take care of stress, take care of alcohol, take care of inactivity, most people are riding Okadas and motorbicycles and cars all over. If we can take care of these, we should be able to control these cardiovascular diseases.
How much is inactivity a contributory factor to this? Because we hear the refrain constantly about sedentary lifestyles and all of that.
Yes. Yes, so sedentary lifestyle is as bad as any risk factor, not just for cardiovascular diseases, but a lot of other factors, conditions. So for cardiovascular disease, inactivity leads to buildup of unwanted chemicals also, you are not able to use your heart. The heart becomes lazy in a way. And once you don't use it, you're not keeping your heart active, things tend to break down. So most people, even now, there's a movement towards encouraging employers to get their employees to exercise regularly, to move around in the offices. And we have examples of CEOs who have treadmills in their offices or bikes in their offices. While they're on a conference call, they'll be riding the bike. And unfortunately, in Africa, we've taken to high technology in a different way, and also the fast-moving vehicles.
Yeah, because if you ride a bicycle in Accra, chances are if a car doesn't knock you down, you are seen as poor, broke, and hopeless. It's only the reason why you are riding a bicycle. And yes, the trottoir drivers have no regard, or drivers generally have no regard for a biker.
Yes, unfortunately. And even newer communities do not make room for biking. They do not make room for walking. So, and the Western world, newer communities have to provide. If they don't make room for biking and running and jogging and walking, they will have a community center where people can go and do those activities. In Africa, there's so many new buildings coming up, but hardly do you see any provision for activities like this.
I have a friend of mine who is upset. She's a Ghanaian German. She's upset because she can't get a place to walk in Ghana. And I've been to Germany with her a couple of times. And when we are walking by the street, she's so excited. She's like, this is what I miss in Ghana. Yes. Why are our policymakers not considering some of these things when they plan our cities?
I think Ghana, we have excellent policymakers. It's the implementation. I think town and country planning have excellent plans. If you look at the layouts of most communities, on paper, it's excellent. It's to the point where they have community centers, they have marketplace, they have places of things like that. But when they implement and they sell the land, what actually happens is nobody's business, I think.
Even if they provide the pavement, people will come and sell on the pavement.
Exactly.
And we are talking about companies providing for providing room for their staff to undertake activity. Multimedia is organizing a walk tomorrow. Okay. They've made it compulsory for everybody to come. If you don't come, you are fined and all of that. But is the advocacy enough? Have we made sufficient advocacy for everybody to be aware of the dangers of hypertension and the rate of death? You just said that hypertension and other heart-related conditions are the #1 cases when it comes to outpatient department attendance.
Yes. I think advocacy is yet to be really taken serious in this light. And I like the way Joy TV has picked this up. Other media are also picking it up. We have to educate our people. The Bible says, for lack of knowledge, my people perish. And so, if we do not educate ourselves, we do not take non-communicable diseases. So non-communicable diseases are conditions that are not transferable from one person to another. And examples would be hypertension, diabetes, high cholesterol. If we do not take these conditions serious, then the next generation of Ghanaians and Africans are going to be in deep trouble. The Western countries, they've been able to control, not cure, or take care of it. So the people are able to live to longer lifespans. In Africa, unfortunately, it's getting the young too early. People are dying.
Why is that?
I think education, ignorance and education, and also the reliance on natural solutions. Natural solutions, herbal preparations, cocktails, quick fix, rather than seeking to know. For instance, the theme of this year's World Hypertension Day is know your numbers. What is your blood pressure? Not today. What is your blood pressure tomorrow? What is your blood pressure next year? Is there a trend? Are you getting closer to 140/90? What is your trend? You have to know it.
It must be a consistent effort to know the numbers and keep track of them.
Exactly, exactly. So that you and your doctor will enter into a dialogue, negotiation. You like to drink, your doctor says stop drinking, then you show the doctor that I can still drink a little bit and keep my blood pressure down. Otherwise, there's going to be discourse. And so, if you don't know your numbers, you go to hospital, they check your blood pressure, you don't show any interest, the nurse might not be able to educate you, the doctor might not be able to educate you. But if you show interest with due respect, the doctor is obliged to tell you your numbers are getting higher every 3 months. So you need to do something.
But Doc, when you go to very many villages,
yes,
there are people who have no access at all to any medical facility. And we ran a story this week about pregnant women in villages in Upper West region who have to travel long distances to even have access to a clinic where they can have safe birth. And as you know, many of them lose their children, some of them actually lose their lives. People living under those circumstances, how are they able to check all of this, go to a doctor and check their hypertension and keep they are even illiterate in the first place?
Yes, so I think Ghana Health Service and Ministry of Health has a policy. And I think under the current minister and his deputy and the current leadership of Ghana Health Service and Ministry of Health, the CHIPS program where they are bringing healthcare to the community.
The CHIPS compounds.
Yeah, compound. I think if we embrace it, that will be part of the solution to this canker. If we can embrace it and educate people. For instance, the other day I saw National Service personnel controlling the light, and you saw them. How about we educating them to go educate people when they go out? That will be a big undertaking, but guess what? If the whole population is educated, we cut down on all this unwanted death. So some of them can be traffic controllers, some of them can go through short courses that can make them health educators for the 1 year that they are supposed to serve. And they can go to community. My national service, I was an evening English tutor in a village in Tamale. So I remember riding my bicycle to this place to educate them. If I was given the chance to also add health education to my duty, I could have done that.
Doc, apart from the conditions that you spoke about, yeah, the hereditary factors, the lifestyle, smoking, alcoholism, the food that we eat, excessive salt consumption and all of that, is there any medical explanation for, or is there a basis to say, medical basis to say, blacks are particularly predisposed to cardiovascular diseases such as hypertension?
There have been a number of research into this question. Why are blacks so predisposed? And it's not one single answer that has come out clearly to tell why we're so prone. But looking at certain factors, there's a chemical inside the vessels of every person, the pipelines, endothelin. Endothelin is a chemical, and some have found that these endothelins, okay, and also nitric oxide, there are issues with these when it comes to blacks. On the other hand, too, maybe we are genetically predisposed. And then when we are exposed to extreme pressures, then we cannot cope. Then we reveal most of these non-communicable diseases. For instance, yes. For instance, why is it that it wasn't so common in those years, in the 70s, in the 60s, in the 50s? Why is it that it was not so common. Probably we had a better society where we're laid back, we're simple, easy-go life. Then suddenly we're exposed to Western life. We have to keep up. We have to multitask. We have to live our simple lives. We lose our societal buffering system. So all of this, acculturalization, let me steal that from Professor Matikoli and Professor Amwa. This acculturalization has exposed the youth to a lot of unwanted stress. So I think the black man is, you're right, is predisposed. The black woman equally is predisposed to diabetes, high cholesterol, hypertension, kidney failure. And when you look at the combination of these, we're in deep trouble. We're in deep trouble.
Do the figures discriminate between male, female? Male, female, who are more predisposed? Do we know?
Yes. In the younger age, to some extent, men are more predisposed. After menopause, when the woman stops her menstrual menses, then the women are equal, sometimes even more than men. So, for instance, heart attacks. Rarely do you see a 40-year-old woman with heart attack. But you can see a man 40 years with heart attack. But I'm not saying that it never happens. After 60, when the woman goes into menopause, the numbers are almost the same. So in a cumulative nature, you tend to see that the men are more exposed to these factors and more prone to heart attacks, heart failure, and other things. But women at that age, from postmenopausal area onwards, severely affected.
Wow. Doc, we have to take a break at this point. When we come back, I'll be asking from Doc, why is that the case? Why are men largely more predisposed to hypertension? And what are the solutions? What are the prescriptions? How can one manage with this so that you can live a longer life, even if you are diagnosed with hypertension? You are watching PM Express and we are discussing hypertension. We'll be back. Yeah, welcome back. You are watching PM Express and we are discussing hypertension. You can join this discussion by calling us on 030-2211-70124. 030-2211-70124. You can send us a WhatsApp message on our WhatsApp line 0560-800,000. 0560-800,000. Send us a message and we will gladly read it. Doc, before we went on the break, we were talking about the figures in terms of male, female, and you said largely males tend to be predisposed. At the younger age, more males. At the older age, females tend to be, the figures tend to be equal, but largely the men are, males are. Why is that the case?
Yeah, so that is a very interesting case, question. Men have a hormone called androgen. Men, by virtue of our muscle mass and stature, have baseline blood pressures, physiological blood pressures that are higher than women. Men, by our nature, are supposed to be very, very outgoing and looking for things to defend the family.
So we are aggressive, we are passionate, we are...
Exactly.
Okay.
Now, we're also having females who are equally aggressive now. So we could study and see those women, what is the pattern of disease in these women? Single mothers who are taking care of their children by themselves, the stress they go through, sometimes even unsurmountable. So men, by this hormone and other factors, generally are exposed to more extreme pressures. Some people argue that men have a different way of taking care of stress, taking care of multitasking issues, whereas women by nature can multitask easily. A woman can do 10 things and get away with it. Men, sometimes very difficult. So we tend to burden ourselves with so much pressure. And of course, in our society, even though the women have come apart in many fields, academics and other areas, there is still a man society. It's a man society putting undue pressure on the men. And that is one of the factors.
Earlier, you were talking about, when you were listing the risk factors, you mentioned obesity. And it stood out for me because this is a society where being plump is a matter of prestige.
Yes.
How much does that contribute to this problem?
It's so much so that we have to open a new book and probably another session to talk about obesity. In that case, we need more hands on deck. Nutritionists, dietitians, diabetologists, endocrinologists, and sleep study physicians. Obesity is our biggest problem, one of our biggest problems. We have a society where people shun on you when you slim down. Society, when you marry, you have to look plump, or the wife has to look plump. Otherwise, either family members will come and accuse you of not caring for her, or she eating all the food and not feeding you well. We have to educate our
people. Eating all the food and not feeding you well.
Exactly. So we have to educate them that it is no more the case. If you look at our counterparts, the Caucasians, they are always slim. No, of course, I've seen obese Caucasians, but they are mostly slim. They're exercising. They're making sure that their weight is controlled, and they live longer, healthier. We tend to live shorter lifespans because we have not controlled all of these factors, the obesity. Now, obesity is a predisposer to 1, hypertension, 2, sleep disorders, 3, depression, 4, diabetes, 5, cholesterol, 6, joint problems, not to mention all kinds of social and other factors. Insurance now, if you're too obese, they may look at you twice. Life insurance, because you're prone to getting diabetes. So your premium,
which imposes a lot of burden on the insurer.
Exactly.
Let me pick a call from Bolga. Lariba, if you can hear me, welcome to PM Express.
Thank you very much. Good evening.
Good evening, Lariba. What's on your mind?
Please, I didn't get to the very early part of the program. I just want to know that I said something like water. The doctor said drinking a lot of water was very good for hypertension, or was very good for preventing hypertension.
We haven't spoken about solutions yet. I'm sure as the program was on, Doc will be telling us some prescriptions as to how to manage these conditions. So you keep watching the show, Larba. Thank you for calling.
Thank you very much.
Unless you have another thing you want to talk about.
No, I'll just listen to the latter part and maybe if I have a call.
So thanks for your call. Yes, so Doc, you're talking about cholesterol and obesity and how these are increasing problems in our society. Okay, so somebody comes to the hospital, you have diagnosed the person with hypertension. What's the first advice you give to the person?
So the first advice, and I've taken to this advice because of my new experience in Ghana. The first advice is to say accept the condition. Accept the condition and work with me or work with your health provider so we can control it. That's the first thing. Most people deny and refuse to accept it. Once they do that, then it's going to be a rough ride, and the person might end up in very severe and dire needs for assisted care.
You have practiced in the US for more than a decade and a half, and you are now in Ghana. Yes. What differences do you note in terms of people's responses to the diagnosis?
The Western country, USA, they accept the condition immediately. By the time the man or lady comes to you, he's already read. So you better be ready. The doctor better be ready to answer questions, not about the condition, but complications, medications, down the line. These are things that we don't get in Ghana. In Ghana, the question is, are you sure I have high blood pressure? Are you sure the machine is working? Okay. And so
the patient sitting before you
yes.
is asking you whether the machine you use to test them is working.
It's working.
Let me pick a call. Mauli is calling me from the Volta region. Mauli, good evening and welcome to PM Express.
Good evening.
Mauli, what's on your mind?
Thank you very much. Good evening.
Good evening.
Yeah, I want to find out from the doc that if you are hypertensive, and you are on medication after some time, can that correct the hypertensive nature of your problem?
If I understand your question, you want to know if medication can reverse the hypertensiveness to a position where you are no longer hypertensive.
Yes.
Okay. Mawuli, thank you. Doc will respond to your question. Thank you for calling.
Okay, thank you very much.
Yeah.
So, Mawuli, thanks for your question. It's a loaded question. It's a loaded question in that if I can get him well, you could either be asking, can you stop the medicine after the blood pressure is controlled? Can you continue the medicine? Can you actually be taken out of the medication? So these are variants of his question. Okay. But to talk about hypertension and treatment, once you're diagnosed with hypertension and you and a doctor agree on a treatment line, it's not always medications. It could be the first thing is lifestyle change. Stop drinking alcohol, decrease the salt, exercise. And then he'll monitor you and see. Sometimes the doctor will start medication.
Doc, you have to hold your thought on this one. I have to pick a call. Asari is calling us. Asari, welcome to PM Express.
Yeah, hello. I'm calling from Spintex.
Yeah, Asari, welcome. What's on your mind?
Yeah, I want to know, has it got anything to do with the blood type? For example, if you are blood type O or A, are you prone to the heart disease?
Okay, so you want to know if your blood type predisposes you to hypertension. Yes. Okay, thank you. Great. Thank you, Doc. Doc will respond to that. Thank you, Asari, calling from Spintex.
Okay. So let me, if I can go back to Mauli's question.
Yes.
Then I'll go to Asari. So Mauli's question was about whether if taking the medication for a long time will really correct the BP. Yes, if you are taking the medication that a doctor has given you for a long time, it will correct, one, the blood pressure back to normal range. Two, the deleterious effects of the blood pressure that has happened within you. It can stop it from happening and sometimes reverse.
With the medication. Okay. I have to pick another call. I'm sorry about this, Doc. I can't hear who is on the line. Nane Ekuya is calling us from Sunyane. Nane Ekuya, welcome to PM Express.
Thank you very much.
Good.
I am enjoying your program.
Thank you.
Doctor just said women who are on their menopause are also can get it easily. Let me put it that way. And here is the case due to birth complications. I didn't get to the age that one should go start menopause. Mine is earlier than that. Do I also have the chance of maybe getting it or something?
Okay. Well, doctor will explain this. Nane Ekuya, thank you for your call. Doc will respond to your question. You want to know, she had an early onset of menopause. She wants to know whether she's predisposed as well. Nane Ekuya, thank you for your call.
Thank you very much.
So let me go back to.
So let's deal with Mauli.
Then come to Asari.
Okay, I hear there's another call. There's Frank on the phone. Frank, welcome.
Hello. Good evening, sir.
Yeah, good evening, Frank. What's on your mind?
Yeah, sir. Yeah, I beg you. I'm also following your program, but I want to digress a bit. I would like to find out from Doc. It looks as if my hand has been shaking vigorously. I don't know the cause of it. Can he explain to me the main cause of my hand being always shaking.
Your hand has been, is it the whole hand or your palm shaking from what level?
Like when I get hold of something.
It's as if you are nervous.
Yeah, like when I hold something, then my hand will be shaking.
Okay, Frank. When we finish dealing with our matters relating to hypertension, I'm sure Doc may respond to this one. Thank you for your call, Frank.
Yeah.
Okay, so we are dealing with Mauli's question about medication, whether he can rely on medication and reverse the condition.
Okay. So let me go back to where we were. So Mauli, when you are diagnosed with blood pressure and you and the doctor begin a treatment plan, as I was saying, it doesn't necessarily mean medication.
Okay.
But whatever it is, if medications are started, then you still have to do the other things. Low salt diet, exercise, no alcohol, reduce stress. And then if you smoke, stop smoking. If you don't exercise, you are sedentary, start walking and exercise. If you take the medicine for years, most often the blood pressure is controlled. However, taking yourself off the medicine without the doctor's knowledge or permission can lead to rebound of the BP. And sometimes that rebound can be very, very serious. So most people can go up to 5 medications. But by and large, we start with 1 medicine at a time and then monitor the effects of the medication, whether the response is good. And then as time goes on, if we achieve a goal, and that's why you need to know your numbers, you and your doctor will agree on the target. So you understand that I want my BP to drop from 160 to 135 systolic. Then once you get there, you continue the medication. The doctor might try to wean you off some of them and leave you on 1 medication or just 2. But whatever it is, those are the things that are keeping the BP down. If you stop the medicine, Mauli, what can happen is the BP can rebound. And the medications are sometimes calculated to help you reverse the bad effects of the BP. So what does blood pressure do? It damages the vessels, it can damage the eye, it can damage the brain, it can damage the kidney, and of course the heart can be in trouble. So the medications are calculated and tailored to each individual, looking at side effects and then the benefit from the medication. So for instance, if I have a diabetic who has blood pressure, one of the medicines we use by research is called an ACE inhibitor or an ARB. These medicines have been shown to be very beneficial to those types of patients. However, a non-diabetic might not use that medicine. I'll give a different medication.
So there's everybody and their own peculiarity.
Exactly.
Okay, may we respond to the other questions?
Asari.
Yes.
Yeah, Mr. Asari, about the blood type. There's a book going out there that says blood type, the type of food you should eat, and the type of... Unfortunately, our grandparents and forefathers never knew about blood type, and they lived. Okay. Naturalists, those who believe in herbal medicines, natural medicines, trying to use nature to dictate whether there are certain things that can go wrong. I don't have anything wrong with that. However, I haven't come across, and I've been a cardiologist for several years now, that if you're type A or AB or O, you have blood pressure. I haven't come across it. So blood type hasn't got a link. However, there's something called type A personality, which is a psychological phenomenon where people are go-getters. They are always on the move. They are getting to do things. Type A personalities.
They never sit at one place. They are always on the move.
They're trying to get to higher heights. Type A personalities are prone to a lot of cardiovascular diseases.
Because they are never satisfied
with where they are. So they're putting more load on them, more tasks. They engage in a lot of,
risk-taking,
exactly,
always ambitious.
Exactly. So those people are prone to high blood pressure.
So that's type A person. It has nothing to do with blood
group. No, okay. It has nothing to do with blood group. Nana Ekuya's question was, she got menopause too early. Nana Ekuya, there are 2 things that I need to know. One is, are you menopause or your womb was taken out? The fact that your womb was taken out doesn't mean that you are menopause. Menopause is a physiological state where the hormones, the female hormones, estrogen and progesterone, the monthly cycles dwindle to or near a halt, where the woman, after that period, ceases to have her menstrual flow. What it means is that even though your womb has been taken out during the childbirth, and I'm sorry about your complication, it doesn't mean that you're menopause yet. The fact that you're not having your period doesn't mean that you're menopausal. It could mean that your hormones are still going on. The estrogens are still going on, but you're not getting your menstrual flow. That's not the same as menopause. Menopause is a period in age. Sometimes it comes early for some families, 45, that's very early. But by and large, 50 to 60 thereabout, that's where most women get into menopause. And it is preceded by symptoms called premenopausal.
And it is physiological, it's not surgical.
It's not surgical. It's not surgical. The only time a surgical procedure can cause that is if the person, a young lady, has a tumor in the ovaries and they couldn't salvage it. Then the surgeon will be forced to take the ovaries out. In that case, at that young age, most often they will give the person the hormones till the person is of the physiological menopausal age. So, the best way to find out whether you're menopausal is to talk to your doctor, get your hormone levels, estrogen level, progesterone level, get your other hormones, or see an endocrinologist.
Okay, I hear Lariba is back on the phone. Lariba, do you have any question? Welcome back.
Thank you, Mr. Malik. Please, I want to know if nifedipine, if I've had the word correct, is the only drug for hypertension. Because my sister had this hypertension thing for close to 7 years. And anytime she goes to the hospital, that was what was administered to her. She was taking it, and she could get seizure. I don't know if hypertension also causes that too. I want to find that from Doctor.
Doc, did you hear the name of the drug she mentioned?
Yes.
Okay. All right. Larva times, doctor will respond to that.
So let me, if you don't mind, Frank, you said Frank will do it later, right?
Yes, Frank was talking about his hands shaking. And he wanted to know what the cause is.
Just a quick one for Frank. Frank, handshaking is called tremors. They are sometimes, they are needed if you are anxious. If you're going for an interview or you're going for a job and you are a little bit anxious, your hands can shake sometimes. But unintentional tremors, which it seems like he's having, can be explained by multiple things, but most often it has to do with nerves, the brain and nerves. So it will be better to see a doctor. So now there are chemicals in your body that can be too high that can make you have tremors, like the thyroid hormone. So Frank, I'll refer you to your local doctor, let him examine you, maybe refer you to a neurologist.
Okay. Let me talk to Salifu from Sunyani. Salifu, welcome to PM Express. What's on your mind?
Yeah, I want to ask Doc, what is the relationship between stress and hypertension?
The relationship between what?
Stress.
Stress.
Yes, and hypertension.
Okay. Thank you, Salifu.
Okay.
He wants to know the relationship between stress and... But there was a call from Lariba who asked about a particular medication. I have to pick another call. Frank is calling us from Takrady. Frank, welcome to PM Express.
Yeah, thank you, Malik. Good evening.
Good evening.
Yes, I really am enjoying the program.
Thank you.
And Doc passed a comment where in the developed world, you can go to your doctor and have a conversation with him. Unfortunately, our part of a society, you go to the hospital and then you try to, even with malaria, you try to tell the doctor, I have malaria. You know, some get offended. I have had that experience before. Get offended that you are trying to tell him that I'm suffering from this. So I think if our doctors too can also, like doctor-patient, that communication, that friendship, it's realized, I think it's going to also help us. That's my contribution.
Thank you for your contribution, Frank, from Takrady. Thank you very much. Yes,
So,
doctor.
Larva. Okay. So, Larva, nifedipine is one of the many medications for hypertension. In hypertension, the medications are grouped into families. So, nifedipine belongs to a family called calcium channel blockers. There's another group called beta blockers. And there's a third group called ACE inhibitors. These are all medications that were detected to lower the blood pressure using different mechanisms. So in the family of calcium channel blockers, nifedipine, amlodipine, felodipine, these belong to the calcium channel blockers. In Ghana, the commonest blood pressure medication that we use is amlodipine, which is a very close relationship, has a very close relationship with nifedipine. Nifedipine is also very common. And what they do is they relax the muscles of the blood vessels and lower the blood pressure.
I hope none of these is over-the-counter medication.
No.
Okay.
Most blood pressure medications are never over-the-counter.
Okay.
And the pharmacists know that.
Okay.
Yeah, I've done so.
So,
okay, let me pick a call from Kobina Mensah from Kumasi, and then we can deal with the Larva's issue. Kobina, welcome to PM Express, if you can hear me. Kobina?
Yeah, sir. Yeah, good evening, sir.
Yeah, good evening and welcome.
Yeah, thank you. I just want to ask the doctors this one. I went to hospital last 2 months. I checked my pressure. It was 120, 70. The next time it was 108, 70. But last week it was 120, 80. But my problem is for about a year now, I always have pain, serious one, at my left shoulder up, and at times I could feel the pain inside my armpit. I don't know whether the doctor will be able to give me some advice.
Okay. Thank you, Kobina, for your call.
Okay.
Okay, so we are dealing with Larva's drug.
So nifedipine is a very common drug, and it's used almost worldwide. It's a common drug. The problem with nifedipine is sometimes headache. Sometimes it can cause headache.
She said her sister used to have
seizures.
Seizures.
Yes. There's no side effect from nifedipine or calcium channel blockers noted to be seizure. So seizures are generally electrical activities that are uncontrollable from the brain. So suddenly the brain just fires a barrage of electrical activity and then puts the person into a state where the muscles contract and then they may fall down. There are various types of seizures, but that's the commonest one, the grand mal seizure. So it has no relationship to hypertension, direct. Indirect, if somebody gets a stroke from high blood pressure, the person might have a seizure. If the person's blood pressure shoots up suddenly, it may cause a seizure. But seizure generally has a different etiology, meaning cause.
There was another question?
Salifu, stress.
Yes, Salifu, is there a relationship between stress and hypertension?
Right. I also noted, Salifu, thanks for your question. I noted the definition of stress by most Ghanaians that I've encountered is different from what the medical
stress,
yes.
You know. Okay.
So you ask somebody, are you under stress? He says, no, I'm not stressed, I can sleep. But he's building 3 houses. And then he's trying to go to America. He's trying to do a degree course in PhD. That is stress. That is stress. If you have a workload that is beyond control. So stress, every day's life, we're under stress. So the stress we're looking for is something that is beyond your control. So if you're multitasking, you're doing things that are too much for you to handle beyond your physiological limit, then it becomes a stressful event. Stress is necessary so that we can prepare, we can mitigate whatever we're facing. But when stress becomes bad, it goes beyond your body's ability to mitigate, then we have a problem. So stress leads to chemicals in the body that can raise blood pressure, like adrenaline and other chemicals. So stress has a direct relationship with high blood pressure.
Okay, we don't have too much time left, Doc. Somebody wants to know how many minutes should he exercise? Another person wants to know whether if he drinks warm water and Milo, whether that can mitigate any hypertension.
Yes. So let me just link the warm water and then the water drinking that was asked earlier by Larba. Yeah. Water, the body needs water. Our body cells swim in water, literally. So if you're dehydrated, your body does not function well, your kidney does not function well, you become weak and tired. So a lot of people, we especially in this hot environment, we encourage that you should drink at least 3 liters a day. If you're a young man, if you're a heart patient, then you have to talk to your doctor to see the limit. But if you're a young man, you're urinating well, you're having a very boisterous lifestyle, drink at least 3 liters a day. That means the water bottles, about 6 of them a day, or 6 sachets a day. That would be fine. Most often, we don't do that. Now, drinking water doesn't mean that you should just drink pure water. You could drink liquids. Light soup is considered as liquid. Coconut water. So that helps a lot. However, talking about various liquids that can be deleterious to the health. Alcohol is deleterious to the health, even though it's a form of liquid. Okay, wine, all the beverage, alcoholic beverages are deleterious to the body. Of course, if you drink polluted water, now we're having polluted streams from all this mining activity. You have to be careful. The chemicals within those streams does not cause problems.
So, Doc, in 30 seconds, what are those steps that we have to take to deal with this in 30 seconds?
Step number 1, please know your number, know your blood pressure. The normal blood pressure for most young individuals or even old individuals should be below 140 systolic, should be below 90 diastolic. If your numbers are high, discuss with your doctor. Get a doctor. Don't go to the pharmacy and twist their arms to give you medications. Get yourself updated with your blood pressures and start an exercise program. How long should we exercise? 30 minutes a day, maximum 2, 3, 4 days a week. If you want to get a really good cardiovascular health, then they say 5 times a week is very good.
So exercise.
Exercise.
Dr.
Thank you very
Joseph
much.
Atia Akama, thank you very much for honoring us with this expose. You just heard consultant interventional cardiologist Dr. Joseph Atia Akama giving us exciting explanations to this difficult problem of hypertension. Let me say thank you to a number of people who called out: Lariba from Bolga, Mauli from Volta, Asari from Spintex, Frank Nerekwia from Sunyani, Salifu from Sunyani, Frank from Takradi, Kwabena from Kumasi. Thank you to all of you for contributing to this discussion, including those who sent us messages via WhatsApp line. God willing, we will bring you another exciting discussion next week. Until then, my name is Malik Abbas Dabo. Do have a good weekend.